We go now to our reporter Lora Windsor with some important information on OB education.
If you are planning on having a baby, it's very important to take good care of yourself so that you and your baby are healthy. We spoke with Dr. Karamardian at Hoag Memorial Hospital Presbyterian in Newport Beach, who gives us more information on prenatal education and why it is so important.
Prenatal education is education and information given to women during pregnancy, prior to, and afterwards to help them with all of the problems and issues that go along with carrying a child and becoming a new parent. So prenatal education involves being able to counsel women, to help them pre-pregnancy so that they have better outcomes, to be able to help them with the changes that are going on with their bodies during pregnancy, and also afterwards with helping them to cope with being new parents. Several studies now actually show the importance of prenatal education. One of the areas where there's recent literature or data that's very compelling is with breastfeeding and breastfeeding success. Women who had undergone childbirth education classes actually 6 months later had higher breastfeeding success rates than women who hadn't taken any of these courses. And that's a perfect example of how education can help with outcomes. Pre-pregnancy is probably one of the most important areas to sit and counsel a woman because the information that they receive at that time can make a huge impact on their pregnancy and going through it. For example, there are studies showing that women who are at risk for toxoplasmosis, if they're counseled ahead of time, can change behaviors as far as who changes the litter box, who does different things like that, and it makes a huge difference in their risk for a pregnancy. Sometimes by the time a woman is already pregnant and you share that information with her, it might be too late and she's already been exposed.
We asked Dr. Karamardian, when should someone be thinking about getting prenatal education classes?
The best case scenario is prior to attempting conception. So a patient can come in, you can go through their history with them, you can say what medications do you take, what medical problems do you have, what type of a job do you have, what are your exposures there, and what type of support do you have at home. And so you can be able to counsel the patient and make important decisions and provide them with vitamin supplementation, which is a huge area where you can make an impact.
How often should a woman see a doctor during her pregnancy?
So women are initially seen monthly in the beginning of their pregnancy. In the third trimester, they'll be seen every 2 weeks. And in the last month of pregnancy, they're generally seen weekly. And that's assuming that things follow a normal course and they're not a high-risk pregnancy. I think education is important because it helps to empower women to feel that they're a part of the decision-making process. Previously, there was a shift when all of a sudden births became a process that happened in the hospital to make them very medical and to change things. And then there was a shift the other way that there was this impetus to have everything be natural. And I think now where we're at, childbirth education helps women to empower them to be able to make decisions about what they want for their birth process. So it's not that they want an unmedicated delivery or they want another process, but that they actually want to have a process that they're comfortable with. And a lot of the education that goes on in the maternity ward is really helping those parents cope with being first-time parents and helping them with all of those issues and things that come up. Part of the education is what we call anticipatory education, and really the most important part of that is just playing out scenarios when you're in these childbirth classes with the parents and saying, what would you do in this situation? What we're trying to do is get parents to problem solve and see what they would do. Because as you say, these children don't come with a manual. Not every kid, as I tell my patient, not every child reads the book. So you sometimes have to improvise and you really need to help patients with coping skills with being a new parent.
Having a baby is one of life's most cherished moments. So if you're planning a pregnancy, make sure you get the proper prenatal education to ensure for a healthy mom and baby. For the American Health Journal, I'm Lora Windsor.